Hi, I'm Michelle Balbi, one of the co-owners of Misha Aesthetics. I am so fortunate that I am a nurse. I actually started my nursing career at Montgomery County Community College, where I got my associate's RN. Started out in surgical trauma, pediatrics, and found my way into home care doing wounds. Fell into aesthetics a little bit by accident. I am super proud of myself. I went back to school. I got my BSN, and I am now about 8 weeks away from graduating with my nurse practitioner.
How did you choose to work in this specialty of cosmetic injectables?
So the cosmetic injectable specialty actually came to me, and I'm going to call it a little bit of fate. I had known a plastic surgeon that I was talking to about a few other things. And when I was talking to him, he asked me if I'd be interested in being his patient consultant coordinator, and it got my foot in the door for a whole new realm of nursing.
What is your advice to new nurses interested in your specialty?
So my biggest advice that I tell new nurses who are interested in aesthetics is A, they need a certification in injectables. They need to go to a medical spa or medical office that offers injectables so they can plan on putting in the time to shadow at a medical office or a plastic surgeon's office so they can become comfortable with the skills of injecting the face.
Would you recommend medical surgery or other acute care experience prior to entering the specialty?
I am a huge component of people having base knowledge. So what I say about that is get your foot in the door. Do nursing in a hospital, nursing that offers you a wide variety of information to build on this part of your career.
What challenges did you face entering this specialty?
So everybody thinks the world of injecting is very glamorous, but I will tell you there's a lot of things that can go wrong. So when people ask me what my challenges are, it is a long road of continued education. Before you even get a needle into somebody's face, you're probably shadowing for at least 8 months until you can become partly independent.
What is the one thing you like most and the one thing that you find most challenging about your work environment?
I'll tell you what I like most is that I meet the best patients who we now call clients. I have an amazing staff, and there's such good networking across the country for injectors. The most challenging part that I find for myself is that I'm probably an overachiever and I don't know when is when, so I'm always studying and I'm always learning.
What do your work hours look like, and how do you balance life and work responsibilities?
So when people ask me about my balance, I'm not great at balance. Like I said, I'm finishing my nurse practitioner now, but my balance really is to find an activity or a hobby you love so that way you can make sure you stay heart healthy and mental healthy. And my hours have extended a lot because I don't know how to say no to people. So our office hours range from 8:30 in the morning up till typically 7:30 at night. Some of the girls work weekend hours, but I try not to. But I do have that as an option.
And if you were to tell people the one reason to get into cosmetic injectables, what would it be?
The one reason to get into cosmetic injectables is you can change a person's world. And I don't just mean their physical appearance, but injectables has allowed me to not only make people feel better about themselves, but I've gotten to do a lot of cool pro bono things with people who may have Bell's palsy, facial spasms, surgeries on their mouth for symmetries. So I've been able to balance the cosmetic fun part with helping people out and feeling good about themselves. Thanks, guys. I would love for you guys to follow us on our Instagram, Botox by Misha, and I look forward to meeting you guys. If you guys ever want to reach out and have specific questions, please feel free to email me at hello@botoxbymisha.com.